Thank you everyone for inviting me here. I'm really hoping that some of the information that I present will be new. I know everybody in this room has an interest in water, so I'm looking forward to hopefully some good questions at the end. So as many of you are probably aware, there's a whole lot that we care about when it comes to water quality. Today, I'm going to be focusing mainly on nitrate, but I do want to point out that there are many other potential contaminants that we may experience in our water systems. And I want to acknowledge the potential compounding effect of some of these chemicals and contaminants. So when we talk about outcomes research and public health outcomes, it's all about understanding the patterns that we might see, especially in some of these at-risk populations. And then it extends beyond just determining what the cause of the health issues are. So we're looking for those local champions, and we recognize that this is more of a marathon than a sprint, especially in some of the rural populations, where getting in and having these conversations can be challenging. So today I'm going to talk a little bit about what nitrate is in our state, what is happening with our local water systems, the health effects that the literature shows are relevant. And then at the end, I'll talk a little bit about some of the activities that we're doing at the Water, Climate, and Health Program and how those overlap with our local partnerships. So moving into water quality and health, kind of as an overall, for anybody that's not already familiar with nitrate, nitrate is a naturally occurring compound. It's present in the body, it's present in the ground. Where it becomes an issue is when the nitrate that is in these nitrogen-based fertilizers or septic systems or human waste, animal waste get into our water systems, because nitrate is highly soluble. And then we have the increased potential for irrigation runoff and contamination into our local sources. So the people who are really at risk here are those living in agricultural and farming areas, especially those who are on domestic wells as opposed to municipal water sources. So in Nebraska, approximately 85% of the state's population get their water at home from some type of groundwater source. And there are a little over 360 residents who rely on those private domestic wells in the state. So this is important because the current EPA guidelines and what's considered an acceptable amount of nitrate in your water is currently at 10 milligrams per liter. You're going to hear me talk about that concentration a lot today. But the reason that we separate those private wells from the municipal wells is that individuals who are on domestic wells, they bear the burden of those tests. The municipal water sources in those cities, they will test water for nitrate. And again, the domestic people, those people living on those domestic private wells, they're the ones that actually have to go out and secure those tests and run those tests themselves, hopefully on an annual basis. So anybody that's been paying attention to the news the last couple of years, we've been talking about nitrate a lot. I know we talked about it before that, but with a lot of the recent traction that has been going on in the state, thankfully, these are conversations that are becoming more prevalent. And it isn't just those of us on the research world or the NRDs or in the public health sector. We have a lot of farmers, producers, people living in small towns that actually want to learn more about what are nitrates and what are they doing in our water and what does that mean for me and my family. So as concerned as I am as a scientist for some of these contaminants, I am hesitantly optimistic that at least the conversations are happening and that concern is there. So looking at the entire US, this map is really just looking at nitrogen output. So where are the increased risks of groundwater contamination? As you can see, Nebraska is rather red. And I'm sure a lot of you are familiar with this next map that I'm about to put up, which is from DWE. And even though I don't have the overlay today, if you overlay this map with the water systems, it's actually a little uncanny to see how much overlap there is between the water systems and these nitrate contamination levels. This is also where I want to point out again, the EPA guideline limit, which is 10 milligrams per liter, which is red. Some of the health issues and adverse health outcomes that I'm going to talk about today are below that 10 milligrams per liter. So I always pause here on this map and kind of share that some of the health issues that we're going to talk about, they're happening in the yellow and the orange, not just in these red areas. I am not a nutritionist. I have colleagues who are, but I just like to give a little bit of a background about what nitrate is and how it gets into the body. So when N-nitroso, nitrate combines with stomach acid to form an N-nitroso compound. This is what actually causes the adverse events for if it's a cancer, this is the compound that actually leads to that adverse event. There are also nitrates found in red meat, and nitrates can be increased by things like smoking, but they can also be decreased with things like antioxidants. So getting into the human health aspect, the EPA guideline of that 10 milligrams per liter that I keep talking about was actually originally set up for blue baby syndrome, which, as you can see from this image here, is what has happened to this young infant. Methemoglobinemia happens when babies consume water that is contaminated with nitrate, and therefore the EPA set that guideline of 10 milligrams per liter. There are numerous scientific studies, a lot of which I'm going to share today. Feel free to take any pictures of these slides. I put a lot of the citations on them, so if you want to go read the literature that I'm going to present today, feel free to write or ask me when we're done. So when we talk about adults that are exposed to nitrate in water, in addition to just general malaise and poor health, we see things like thyroid conditions, abdominal cramps, more severe health conditions like diabetes and Alzheimer's, and then of course the big one, which is cancer. Cancer is where I spend most of my time as a cancer population scientist. So these are the things that I go out and when I talk to people in the community, I really don't enjoy telling them, but everyone needs to be aware that these are the risks with consuming nitrate contaminated water. And so you'll see after each of these types of cancers, for example, thyroid, colorectal, kidney, bladder, lymphoma, in some of the literature in the last 10 years, this is the number of studies that have studied the association between consuming nitrate contaminated water and that health outcome. So for colorectal cancer, there were 5 studies included in this review, 4 of which found a positive association. Moving on to children, there's quite a bit of data out there that supports, in addition to methemoglobinemia, the link between pediatric brain cancer and nitrate contamination, as well as lymphoma. This last study on this slide, I think, really comes back to that compounding effect that I mentioned at the very beginning. There suggests that there may be an increase in the incidence of non-Hodgkin's lymphoma when children are exposed to both nitrate and atrazine here in Nebraska. In addition to adult and pediatric outcomes, there are also significant effects on maternal and fetal health. So coming back to that 10 milligrams per liter that I know I keep coming back to, we see spontaneous abortions in private wells between 19 and 26. Even more concerning, we see preterm births in some areas, this one's in California, as low as 5 to 10. And then other issues like fetal growth restriction, fetal hemoglobin, issues with methemoglobin in cord blood, and then the central nervous malformations, which see quite a bit. And those also occur sometimes less than 10 milligrams per liter. So looking at some data from Nebraska, Nebraska have a high incidence of the top 5 cancers. So these are colorectal, breast, central nervous system, lung, and melanoma. And for anybody that is not an epidemiologist here or on Zoom, when we're looking at incidence rates, these are standardized per 100,000. So if you look at any of those red counties, the incidence rates range from 546 to 643 individuals diagnosed with one of those types of cancer per 100,000 people. So you can see that incidence rates to me are concerning anything above the light blue, which is a lot of the state. I have to thank Don Coulter for a lot of these images, but these really just show the progression of pediatric cancer in Nebraska and Iowa over time. So with that image on the right, you can see that the incidence rate has been steadily increasing all the way back from the mid-90s. And then Nebraska is in one of the highest states in the country for incidence of pediatric cancers. This was a colleague of mine, Evie Farazi, who worked very diligently on pediatric cancer for a long time and developed these maps, which in my mind, I look at these and I keep going back to that Dewey map of the nitrate contamination and looking at where was the red on that map, where is the red on this map. So these are rates of all pediatric cancer on the top, and then pediatric brain tumor on the bottom. And you can see that some of the consistent trends looking at these data are that up the waterline, and then in the north eastern part of the state, and then that southwestern. This is part of a study that looked at atrazine and nitrate. And so here what we're looking at is just that the age-adjusted incidence was higher in these counties that had both of these chemicals. So before I get into some of the research and activities that we've been doing on our team, I like to pause here and put this image up because I think it's just a really great representation of the exposure to outcome pathway. And so of course you have the cause, the exposure itself, which are sometimes those fertilizers and that animal and human waste, and then what they eventually lead to. But there's all sorts of other environmental factors, social behavioral factors that contribute to this relationship. So I think that it's very important that whenever we talk trying to adjust or interrupt any of these exposure outcome pathways, we have to acknowledge that there are other factors at play. So getting into more of what we're doing about this now. So our goals for addressing water quality issues here in Nebraska and surrounding states, especially around nitrate, are to first identify at-risk areas of people. We want to try to find low-cost, no-cost solutions. And then we want to encourage testing and maintain the systems that are currently in place. A lot of this means working with our partners because we can't do everything, and our partners are the ones who really are in working with these communities. So the first bit of research that I wanted to share today is a survey that we did for healthcare workers in Nebraska. And so what we wanted to find out where did health providers fit in the equation of having conversations with their patients, who are these residents living in these small towns, rural towns, not necessarily all small, but in these areas where they might have higher levels of nitrate. And so we found about 700, give or take, healthcare providers of all different specialties to participate, and they told us exactly how they felt about knowledge and confidence and a few other things that I'll present on later slides. But what I want to point out here is that these physicians that participated in this survey, they reported majority across the board that they were not at all knowledgeable or maybe somewhat knowledgeable when it came to what was nitrate. We asked them, what is nitrate? How comfortable do you feel talking to your patients about nitrate? Do you know about the health effects of nitrate? Do you know about well water testing aside from what you might already do yourself at home? And then they also reported that they were not very confident about having these conversations with their patients, which we can expect. That is linked with the knowledge. If knowledge is low, therefore confidence is also likely low. And then further diving into the literature about why we might have observed these trends, we found that environmental health education is not currently part of the medical curriculum. So these physicians, they're coming out of medical school and they're not receiving education on how to have conversations about environmental exposures, although they, sorry, I have to give you guys this information first. They do want information, but a little more depressing stuff first. So when we asked them about what were the health effects of nitrate contaminated water, the qualitative responses were a little astounding. They ranged from methemoglobinemia, cancer. Some of these physicians, they knew what was happening if their patients were going to consume this nitrate contaminated water. Others, no clue. And they wrote that on the survey. They said, I have no idea. No, I've never heard of this before. I wish I was. And then from that qualitative data, we found that there was really a low identification of methemoglobinemia, which is the original impetus for why we're actually testing and tracking that water. So just to kind of belabor the lack of knowledge, lack of formal education, 94% of the participants in this survey had not received any type of formal training on health effects for nitrate. And a concerning 25% acknowledged that it was even a health concern. So the good news, they were actually fairly receptive to the potential of giving information to patients about nitrate. And so when we asked them, if we were to give you these resources, would you use them? And the answer was most likely, yes, we would use these. We also asked them, where do they currently get their resources? And it was variable. You can see that we actually stratified the data into a couple different categories because we wanted to understand who was using which resources so that we can do the next phase of this project, which is the implementation side. We also selected a subgroup for analyses, for additional analyses, and I won't spend a whole lot of time on these, but I just wanted to throw this up here to give you guys an idea of the characterization of these participants. So these physicians were seeing a wide range of patients, from a handful to 50 or more. They were hospital-based, clinic-based mostly, and then they also saw a range of urban, rural, and small rural patients on a regular basis. So what we learned from that detailed statistical analysis was that attitude was a strong and significant predictor of information sharing behaviors, because we wanted to really get at if we were going to implement some type of intervention, how could we make the biggest difference? And so would it be increasing knowledge? Would it be increasing attitude? In this analysis, what we found was that the knowledge was really not a significant indicator of the information sharing behaviors, which in our case is good because the knowledge was low. That means that now we can go in and we can provide these materials, and hopefully they'll be very useful, which is the next phase. So in addition to asking them where they currently got their information, we also asked them, where would you like to get this information? How can we help? And what they told us was that they really wanted a resource website with educational materials. They wanted somewhere that they could go and just like Google, and they could just pull up information fact sheets to hand to their patients who might be pregnant, who might be on domestic wells. Where can they go for well water testing? Where can they get an RO system? And then they also wanted brochures that they could print out and hand out in clinic. So that is actually the next phase of this project. Becky in the room here is part of this intervention. We're actually piloting the website right now, and we hope to have it live in the next 3 or 4 months. And then we're going to take a few really interested physicians and get their feedback on how we can improve it, and then make it available as publicly as we can to all the providers and healthcare workers here in the state. So in addition to surveying the healthcare workers, we also surveyed NRDs. And if anybody in here is an NRD, thank you for doing this survey. If you did it, if not, if you haven't done it, you're going to get a chance to at the end. So we also wondered the same thing. How can we better provide any type of support for NRDs and public health workers here in the state? And even though our initial responses to the NRD survey were fairly low, it was between 22 for some questions and 28 at the very most. Our NRDs are fairly knowledgeable. They're quite confident. They can deliver this material. They can have these conversations. Looking at the qualitative data that came out of talking to these NRDs, they knew about blue baby syndrome. They knew about methemoglobinemia. There were some opportunities for additional training and education, which is where we're going next with this phase of the study. Because 24% of these people, now granted, N equals 28, so just acknowledging that limitation there. 24% of them were not currently providing members of the community with nitrate contamination, drinking water materials. But they acknowledge that this is a problem. This is a high priority issue that we need to be having these conversations. They also, 32% had not received any formal training. And I know from going around and presenting a lot of these data out in Western Nebraska that there are NRD managers and people who really do want some of that training. Unfortunately, with an N of 28, we don't feel like we have enough information to decide what those trainings should be. So if you're an NRD and you haven't done this survey, we reopened it, and we would really love it if you could tell us what type of training, what type of materials, what can we make that would be helpful while you're working in these communities. So shameless plug for anybody that hasn't already done the survey. I wanted to briefly touch on one of these planned projects. This one I'm really excited about. We're in the process of trying to secure some funding for it. Anybody, I'm sure people in this room know exactly who Shannon Bartlett Hunt is. She developed the Sewell Citizen Science Project. And what it does is it encourages community members to go out and test their own well and send the results back to Shannon and her group to be able to track what's happening as far as nitrate contamination in these wells. So what we're planning to do is take that just a little bit further, and in addition to encouraging folks to test their own wells, we also want to promote healthy behaviors. And so anybody whose well comes back under, there's still a little bit of conversation about using the EPA guideline cutoff. So TBD whether or not we'll use 10 or 5 as that cutoff, but the general thought is that anyone whose well comes back in a safe range for nitrate, we would then just provide educational material on how to continue getting their well tested, where to go for free treatments, water treatment strategies, health effects. But then there'd be a special cohort of those people who would submit their tests back, and they would be over that safe recommended cutoff. And then those individuals, we want to connect directly with health services. So working with the Nebraska Hospital Association to connect them directly with low or no cost cancer screening, working with their families to make sure that they have access to some of the healthcare needs that they might have as a result of having that high nitrate, or just kind of helping them through the next steps. Because there's a bit of a drop off. If someone tests their well, then what? How do we connect them with care from there? So this is a pilot study. Right now we're targeting North, Central, Southwest, and Panhandle, because those are some of the hardest regions to reach in Nebraska, at least from our end in this corner of the state. But if you are interested in being a part of this, feel free to let me know, and we'll be happy to just add your region into that proposal. So I wanted to talk a bit about the Water, Climate, and Health Program and some of the activities that we do. This is just one part of a great big machine that's doing a whole lot of really cool research on water quality and climate change. So here's our intersection. We sit in the Water, Climate, and Health Program, we sit right in the middle of UNMC, University of Nebraska, and the Doherty Water for Food Institute, which positions us really nicely because we have access to all of these incredible researchers at each of these three institutions to promote our four pillars, which are research, education, engagement, and policy development. I tend to sit more on the research, education, and engagement side. But it's really important to note that none of these pillars occur in a silo. So at the Water, Climate, and Health Program, there are activities that fall within each of these categories, but then there's crossover in between. And that's one thing that we really like to make sure that we're checking as far as if we're thinking about, checking those boxes. We're not doing research in a silo. All of this water quality work that I do, the nitrate work, the other people's tornado work, we need to be going out, we need to be disseminating that information to the communities. And then we work with local policymakers as needed to kind of connect that additional piece into that research. Just sharing a couple other education and engagement activities that we've had. We've worked on water quality toolkit. We've worked with partners to develop a lot of these different infographics that I usually take with me when I travel. A lot of people might recognize Laura Nagengast there in one of the photos. She worked with us for a long time. This is the water quality toolkit that is still available for anybody that is interested in going and finding out more about water quality. And then recently, these are some of the activities that we've done as far as dissemination. We're grateful enough to be asked to be a part of the governor's task force and serve as SMEs in developing that report. So we were able to at least give some input on why nitrate and recognizing that its effect on the Nebraska populations is important. So that was wonderful for us. We participated in the legislative conference, and then lots of travel. These are a couple of the things that we've done. And then beyond just Nebraska, we also get out and talk to a lot of other people as well. I don't think anyone here is probably going to be taking a picture of this slide, but just in case, the information to the Nebraska Public Health Laboratory is here, as well as UNL's Extension Office for any type of test kits or water testing, if this is something that would be helpful for anybody that you interact with. So in summary, the work that we're doing with Water, Climate, and Health that surrounds nitrate and human health is really about partnerships. That we can't do any of this work in a silo. We need our partners, both our residential partners and people who are living in these areas, as well as our public health partners, to educate and do this important outreach. We're going to continue advocating for well testing and continue our research and hopefully be able to create some educational materials that are really useful for both our healthcare providers and our public health partners. So with that, I'll thank all of our partners. This is the rest of our team, quite a big team. And I will stop there for any questions.
Krista, can you go into a little bit more about the research that the possible connection between nitrate and atrazine has been known for decades? Could you talk a little bit more about the research or any progress in that regard?
I'm not involved in any of the compounding effect research.
Okay.
I would like to get more involved with it. I know that some of our NRD folks are working on doing a small cohort of about 600 well water tests to look at a lot of different chemicals, but until we actually have data like that, for local data and local research, I don't know if there's a whole lot going on, and if there is, it's not in my scope.
Krista. Okay, you're over before me. Okay, thank you. I'm gonna ask you about the standard, the MCL, the 10 milligrams per liter.
Yeah.
And if you think this is even a reasonable limit, because you pointed out in the body, metabolically, nitrate, which is set at 10 milligrams per liter, immediately gets reduced to nitrite. So when there's a nitrate standard of 10 and a nitrite standard of 1 milligram per liter, where's the sense here? Does that make sense at all?
It does. I wish I could comment on the policy. I can tell you that we're working on a review article that will hopefully provide a little bit of leverage in having future conversations around that requirement.
The 10 milligram per liter was basically set by an old country doctor in Iowa, 100 years ago. And so far we haven't had, even with masses of literature and research, which our environmental regulators haven't seen to it, to really look at that 10 milligrams per liter limit objectively and in view of all that research that has been published, not only just in the medical field, but also in engineering and so on.
I would agree. There's a good review article that I cited quite a bit in here from Ward back in 2018 that put a lot of data out there about that cutoff and what is happening in the health level at lower levels. And so what we're kind of hoping is that if we can push out another review article as a follow-up to that 2018, will it give us any leverage about the conversation by just aggregating the data? You know, by pulling together all of these different articles say that, you know, we can see adverse health effects at 2.1 or 5 or whatever that magic cutoff is, you know, just kind of getting all of that evidence in one place. So I agree. I wish I had a magic wand to wave.
Pragmatically though, we got a ton of people drinking more than 10. So I'm like, for education, that's the first part. It's getting that down.
Well, I guess my issue was with the 10 milligrams per liter of nitrates and 1 milligram per liter for nitrite. They're telling us you can drink 10 milligrams per liter, but you can't drink more than 1 milligram per liter of nitrite.
Well,
My question is, what happened to that 10 milligrams per liter of nitrates once you ingest it?
there's a lot of areas that are out there that I go talk to where they're at 50. Their whole town is at 50. And has been. So I don't know what changing that cutoff would look like for them in some of these regions.
What you're doing is really very good. Really appreciate all that.
Yeah. I wouldn't do it without half the people in this room.
Where in the human body does it get transformed? Is it in the stomach or is it in the gut?
As a non-biochemist and a non-nutritionist, my understanding is that it is primarily in the stomach, which is partially what leads to some of the colorectal cancer risk.
It's in the mouth.
Is it in the mouth?
Yeah, it's saliva.
Correct. There you go.
Bacteria in the mouth cause conversion of nitrate to nitrite.
Oh, so it's the bacteria. So
Krista,
how does the oral microbiome then affect?
Yeah, that's a good question. I think there's been some studies on that.
We snort water through our nose.
And so it's a pilot study, and I'm very surprised that the longitudinal survey has not been done yet in this area, because basically, if I see your objectives, the process, you're looking at two things. What is the situation of the Nebraskans' health due to nitrate, and what are the perception of the people about the nitrate in their water? So have you thought about anything to do it? Looking like you, looks like you'll be in the business for another 30 years at least. So have you thought about doing this longitudinal study for every 5 years? Because no matter the nitrate goes down or goes up, environment policy, technology will change. Training of the people in medical providers will change. Educational level will change in terms of this. So looking at how people think from now to 30 years, it will be present after 30 years, and what you did today, be a very consumer education. That way people, it will help the policy, it will help to the generation of that time, and it will help to the people if we will be still in this, how the perception has been changed, how the nitrate level has been changed. How do you
That is a great point, and actually something that we are trying to do, but we're doing it on a much smaller scale. So the Bazille management area, that's where I'm currently working to pilot a survey. Unfortunately, we have to develop it. You know, just like with this CAP survey that we developed for the physicians, I can't find any other surveys that exist that actually assess with domains the knowledge, attitudes, awareness, perception of individuals toward water quality interventions, health outcomes. So yes, we are working on that.
If you don't particularly focus on water quality and all those, but similar study, exactly the way you said, perception, knowledge, attitude, awareness, has been done in, you have to go out of the state, Idaho.
In Idaho.
And they have published a couple of times, a paper in Canadian journal. I was part of that team from 1985, the team which is conducted this study. I was a part of the team later in 2020. I have a couple of papers on that, if you can see it.
I will talk to you when we're done because I want the DOIs on those.
And I'm giving height. Thank you. Back to you.
We have a question from our online audience. So Brian Bruckner, I see your hand is raised. Feel free to unmute yourself and then ask your question.
Thank you. Good afternoon, Krista. Thanks for your leadership on this issue. I'm assuming you're familiar with a recent report that came out of Iowa from the Iowa Environmental Council talking about cancer rates in Iowa and how they consider Iowa as an outlier when it comes to cancer as compared to national statistics. Where does Nebraska fall in regards to cancer incidence rates compared to our national partners?
Thank you, Brian. I have seen that report. I haven't read it in its entirety, but I am working with the group that put that report out. So that's interesting that they say they're an outlier. I would, looking at the data, Nebraska appears to be at least in the top 10, if not in the top 5 incidents for pediatric cancer. I have to go back and check the data for the adult cancers. And I think I'd rather get back to you on that. I don't want to take a guess. But that's a good question because now that Iowa has put that report out, it would be a good idea for us to consider doing something similar and aggregating all of our cancer-related water data together.
Thank you. I just wanted to comment on something that was mentioned earlier in regards to the 10 milligram threshold. I believe it was a year ago or maybe a little bit longer. I believe that requirement is currently subject to its, review. It's been in place for a period of, and now it's time for it to be reviewed, and EPA was looking at that. Remains to be seen, I guess, whether or not anything becomes of that review. Was recently in Washington, D.C. with some colleagues and had a chance to meet with some folks at EPA, and they didn't have any information or any update on that particular concept. And so being someone who is involved in an NRD system and obviously has to administer groundwater quality standards to a drinking water standard, it's definitely something we're concerned about. We also operate 2 rural water systems, and I do know that if that standard is lowered, it's going to have wide-ranging implications for public water systems all across the United States, probably. So, just a comment.
No, I think that's a very valid comment and something that go ahead. Yes.
Yeah, Brian, this is Dick. If you're just listening in, but that's, again, for decades, that has been one of the primary concerns about lowering the nitrate standard to 5 or 3 or whatever. And I think, if you talk to a larger system like Lincoln or Omaha or something, they may be able to absorb that. One of the primary fears there was that if you take some of these very small towns in rural Nebraska, a few hundred people, if you drop that nitrate standard that low, basically, and say you've got to treat this stuff for millions of dollars, they're just going to shut the whole thing down, and everybody will go on individual wells, and you're just compounding the problem. Now, I'm not saying that's a right way to look at it, but I think that is a practical consideration if the nitrate standard might be changed. And Becky, you probably know more about that than I do, but it's not a new argument. So
So another. Oh, go ahead, Brian.
Yeah, this is Steve online. Another question on a little different topic. Knowing that there's some places where some microbial communities have moved into the groundwater, completely eliminated the nitrate. I mean, get it to the point of no detect sometimes, but released other things like arsenic, uranium, manganese, and higher levels than we've seen in the past. Is there any thought in your process to at least add maybe arsenic? I mean, you look at the health concerns with that one, and it's kind of off the charts, and it is a growing problem in Nebraska. It seems like it'd be an opportune time to at least add maybe one thing besides nitrate, because some places you wouldn't find any nitrate, but the water would be, kind of hazardous to drink.
I think that's an important point. To the room in general, because there are so many brilliant minds in here, if you had to name the top 3 in addition to nitrate, arsenic, atrazine, what else? Uranium, manganese, lead. Manganese.
It depends on where you are.
Yeah. Lead is internal. It's a system problem.
It's
an infrastructure. Geogenic. Yeah. But lead, lead could be added to your list. Definitely in Omaha, places like that, we have plumbing issues.
Mm-hmm. The pipe.
But for rural groundwater, uranium, nitrate, arsenic, selenium is also another one that seems to be popping up in places. And there are public water systems that have been put on administrative order for selenium to.
See, in our district, it can be something just as seemingly benign as dissolved solids. But you don't have to go very far because before the water becomes undrinkable, not because it's going to kill you, it's just that you can't drink it. So again, it kind of depends on what your perspective is. Is it an immediate concern or is it a chronic concern?
Yeah, I think there's a perception that pesticides are a big problem, but they're not really. That's what really doesn't seem. They happen in some places, but very few places in comparison to the other contaminants. So.
Well, I think that there's definitely room for improvement there, Becky. I think that on our next team meeting, we'll have a conversation about.
Well, we've had some conversations early on, but
next steps.
Yeah.
Oh
yes.
Because right now it's hard to focus on just one, but it's almost like that is an insurmountable problem already. But to the compounding effect issue, I mean, from a health perspective, that's something that I would really be interested in measuring. If we can get some tests, I would really like to measure the associations between the compounded, arsenic and nitrate, or atrazine and nitrate, or uranium and nitrate. And then on an individual level, but those data sets don't currently exist here, so might just have to make them.
So I just add to my comment that, nitrate across Nebraska is very traditionally kind of been a really great canary in the coal mine, right? I mean, if that was there, then you start thinking there might be some other problems. But today we just have some areas that the nitrates just disappeared. I mean, it was there at one point, but it's gone away. And we don't want to lull people into having a false sense of security if nitrate's not there, that their water's great, I guess is my only comment on maybe adding something like arsenic. And I understand things get expensive in a hurry, but that's, it just seems to me that where you're rolling this out, it might be good to add at least one or two more to the standardized testing.
And it wouldn't be bad to have to add it to the conversation with the healthcare providers. I mean, the NRDs, those folks, they already know, but the healthcare providers, they might not. And so I think there's some opportunity there for education in addition to the nitrate. Appreciate the conversation. That was much better than just straight questions.
I noticed you had high school and middle school curriculum on one of your slides. Have you looked at what Know Your Well is put together for the groundwater quality curriculum?
I am loosely aware of it. It's something that I'm trying to tap more into. There's a groundwater festival in Grand Island next month that I'm going to try to get more involved with some of the Know Your Well type activities. But from the research side, I wasn't involved in the Know Your Well at all, but not opposed to it.
But it's out there and available.
Yeah.
And the data is available too if you want to use it.
Oh, okay.
Yeah.
I will have to, who do I contact for? Oh, right there, all right. That's asking the question.
Well, that was a shame.
Well, that's good, because you don't know what you don't know, so I didn't know that there was data available, so I will take you up on that.
Great.
I have one more question pop up from our online audience. They'd love to hear if there's any continuing concern about pharmaceuticals in water.
Well, that's a new one for me, like, wastewater? No, it wouldn't be wastewater, like, I mean.
Water, I guess. Doug, if you want to unmute yourself and kind of give some more context, you're welcome to.
GPL1?
Yeah, I just a number maybe 10 or 15 years ago there was some pilot studies just where they were finding some pharmaceuticals in groundwater, and I think correlated or nearby feeding operations and whatnot. And I'm wondering whether those concerns are ongoing or whether those were found to be less issues that aren't of primary concern.
I would be interested to read the background on that. I haven't heard of it, but that doesn't mean that it's not a concern. Yes.
I think I know the study that you're talking about, and the only areas where we can detect them were the groundwater is impacted by wastewater. And when you talk about expensive costs for monitoring, that they're like an order of magnitude higher. But in general, the only places you're likely to find that is maybe from livestock wastewater or potentially from septic systems that aren't being operated properly.
Do you remember, Dan, do those compounds persist very long in groundwater? I couldn't remember. Yeah.
Just like a lot of stuff.
Yeah.
Once it gets in the groundwater, it's hard to get rid of it.
Old and dark then. Yeah.
It's interesting.
Okay, well, thank you all for a great discussion today, and let's make